So let's just start in the straddle position. We're gonna hold right here, and we'll take a look at the clock. We're at about 2:15, so we'll stay here till about 3:15, 3:30. And what we're gonna do is just focus on your inhale and your exhale. So inhale through your nose, fill your belly, fill your rib cage, fill your upper chest, hold it at the top. And then exhale, let everything go. And then try to inhale 5, exhale 10, and just focus on slowing your breathing down. And I have my hands behind me here, that's helping me stay upright. So if I'm stretching my legs, for example, I don't have to really worry about my back. So if my back is the issue and I start leaning back, then 1, you can place your back against the wall. 2, you can go like this. Or 3, you can just, use your back. So it just depends. Level 1, back against the wall. Level 2, hands behind. And level 3, meaning that, you're trying to work out your back basically. But if you're really just trying to focus on your legs, then it really doesn't matter if your back is against the wall, your hands are behind you, because we're focusing on our legs here, we're not focusing on our back. So it's important to disassociate what you're trying to fix as opposed to using your entire body to stretch or to mobilize something. So if we're trying to mobilize our hip or create mobility in our hip, we don't need to be doing something that is taking effort in other areas of the body, such as our shoulders or our back. So we want to really disassociate that joint or joints, multiple joints, depends on what you're trying to do. Right now we have multiple joints, both knees, both hips. We're abducted here. We're stretching the adductors, we're stretching the hamstrings here, and we're also stretching the hip flexors here. The hip flexors are flexed up, okay? So we're getting all the tissue basically underneath our body. Our hip flexors are actually tight right now. So they're flexed, so they're not relaxed, okay? So we're at about, we've already talked our way to 440. So we've been in this position long enough. So hopefully you're just focusing on your breathing, inhaling for 4, exhaling for 8. And then what we're gonna do is start digging the heels and pretending there's a scale underneath our calf and knee, and we're pressing it into the ground, okay? And we're just gonna press it. We're gonna press it into the ground about 10%, 20%, 30%, you can bring your hands behind, 40%, 50%, 60%, 70%, 80%, 90%, 100%, greatest, safest effort, digging the heels into the ground, digging the hamstrings into the ground, feeling the calves for 3, 2, and then from here, what we're gonna do is we're gonna try to bring our legs off the ground. So trying to extend our knees further and trying to get our legs off the ground. I'm not gonna go anywhere, but keep pressing into the ground and keep trying to get those legs off the ground. And then relax. Okay, so what we did there is we were stretching our hamstrings out, and we passively hold that position. Then we actively start using that tissue, and then we go in the opposite direction. Okay, so that is basically like PNF or proprioceptive neural facilitation. Okay, so if you've never done that before with a trainer, then this would be something new. If you have done that with a trainer, if you learn about it in like a stretching or a flexibility chapter of a book, then you'll see that proprioceptive neural facilitation does create more flexibility than passive stretching alone. And you need the active facilitation, active and passive both, instead of just the passive, to actually improve mobility and like strength in those end ranges. Okay, so that's why we're doing this. For here, the next thing we're going to do, let's go to 90-90. Notice that the knee's right out in front of the hip, the knee's in line with the ankle, ankle's in line here, everything's at a 90-degree angle, including the ankle, knee, and the hip coming out from the waist here. The other hip is right in front of the, right behind the knee, knee's in line with the ankle. This ankle is lined up with the knee and back ankle, this foot is flexed. And make sure this knee is straight in front of this hip. This hip is out with this hip. So it should look like a good 90-degree angle, 90-degree angle. Everywhere we're looking for 90-degree angles. Facing forward, facing the front leg or the lead leg, we're going to kickstand our hands out beside us, bring our chin up in line over our sternum and our navel. And we're going to take an anterior pelvic tilt. And once we get into this position, you should feel a deep stretch in that front hip and glute. And then you're going to start bowing out the chest, bringing the head up slightly. Breathe into that. Again, we're going to hold here for about a minute, and then we're going to start our active and regressive stretches, or our pals and rounds. Just breathe here. We're going to start pressing the foot, the shin, the knee, the hip. We're going to start pressing it into the ground. 10%, 20%, 30%, 40%, 50%, 60, 70, 80, 90, 100. Hold it, safest, greatest effort. Squeeze the whole entire body. Everything's recruiting muscle fibers to make this contraction even more. Keep going. 3, 2, and 1. And then from here, opposite direction. Trying to pull the knee and foot off the ground. Hold for 10. Pull it up. And then come back to your passive stretch. So that would be external rotation of the lead hip. For external rotation of the lead hip, we're going to do pals and rails or some active and regressive stretching. Okay. So from here, we're going to show you internal rotation, pals and rails. We're going to rotate toward our back hip, and we're going to reach toward our back foot. If you can't get the foot, just hold on to your hip here. We're just trying to rotate the thoracic spine all the way back. Once you get here, you should feel a stretch in your back hip. If this is too much on the knee, you can bend the knee a little bit more, or you can do this standing on a desk or a table. And what we're going to do is just twist toward that back hip. And we're going to hold here and breathe. Inhale for 4, exhale for 8. Now we're going to begin actively contracting the tissue that's being stretched. So we're stretching out all the medial tissue in our lower limb here. And we're going to press that tissue into the ground and contract that tissue into the ground from 0 to 100%. 10%, 20, 30, 40. All muscles are recruiting. 50% effort. Hold here. 60, 70, 80. Contracting the tissue into the ground. 80%, 85, 90, 100% effort. Squeeze and push. 10 seconds. You should feel your glute maybe shaking. And then from here, we're going to get the regressive tissue or the opposite tissue. Try to pull that foot up off the ground, if possible, without leaning forward. If you need to lean forward, that's fine, but try not to. And then bring it back down and go back to your passive stretch. So that would be internal rotation, pails and rails, or progressive and regressive active stretching. Now we're going to transfer to the other side. And when we do that, let's go ahead and squeeze the hands. We're going to open up the back hip as we turn that toe out. And try to keep this knee on the ground as you open up that hip. And when that knee needs to come up, let it come up in a bear pose. Okay, so the feet are right underneath the knees. The feet are flexed, dorsiflexed here. From here, we're going to transfer over to the other side, nice and easy. We're going to line up in that same position, facing the other direction. From here, we're going to hold steady, anterior pelvic tilt. So we're trying to arch the lower back, bow the chest up, chin is in line with the sternum and navel. Knees in front of the hip, knees and ankles and hips are at 90 degrees here. Breathe and hold. Focus on your breathing. Just try to get comfortable in this position before you start anything. If you need blocks or 2 desks or 2 tables or benches, from here we're going to press the foot, shin, knee, and hip into the ground, 10%, 20%, 30, 40, 50, 60, 70, 80, 90, 100%. Hold for 10. Squeeze everything. 3, 2, regressive angle. Pull it up. Hold it. Higher. Breathe. 3, 2, 1, and slowly bring it down. Big exhale. Hold here, back to that passive stretch. rotation here. Set up, pals and rails. Remember, this was external rotation, this is internal rotation. So if you notice a lot of issues or a lot of feedback or over feedback, then you're gonna wanna take care of that issue and work that hip a little bit more, okay? So your body's telling you something in these stretches. I mean, if it's killing you or if it gets painful, that's a quick sign to let you know that you got an issue, okay? All right, twisting toward that back hip, rotating toward that back hip, pressing the knee into the ground here, contracting the tissue, but we're gonna start with our passive stretch, breathe and hold. Trying to align my feet and knees up. It's a little bit harder for me on this side. This knee wants to jet off the ground. Sometimes you can add weight, load on different parts of the body to really isolate it. You can also bring the hands behind. Try not to move as much as I am here. I'm really trying to figure out where I feel best. You can do the same. Start pressing the knee, the adductors are going to start to contract into the ground. Keep going, even the foot, 10%, 20%, 30%, 40%, 50%, 60, 70, 80, 90, 100% effort. Everything you got, 10 seconds. 3, 2, and then opposite way, we're gonna try to get the foot off the ground. Same thing. Try to get that foot off the ground using the opposite tissue, opposite side of the joint. 3, 2, and slowly bring it down. And then twist toward that back hip. Good, and then we'll transfer back to bear. And then 2 stretches I'll leave you with will be, or 3 will be bear. You hold this position, 1 to 2 minute passive stretch, and then you'd begin by activating and trying to close the book, 0 to 100%, but you'll keep your feet and knees out, so you feel that contraction in the insides, and then you'll go the opposite way, trying to pull those knees to the ground, and that would be your passive, active, regressive stretch, and then you'd go back to your passive. For butterfly, this would be external rotation. Same thing with bear, this would be external. Butterfly, same thing, external rotation of the hips. Press both hips down. You can add kettles if you'd like, get them lower, and then start contracting into the kettles or the wrists, 0 to 100%, and then regressive, going down the other way, knees to the ground, and then back to your passive stretch. If you want to get another internal rotation, go into your bear, bring one knee in, press the outside of the knee to the midline, hold here, you should feel a stretch. You don't need to go any further, hold here, and then start pressing the knee into the hands, 0 to 100%, and then knee toward the ground would be your regressive angle, and then your new passive stretch would be here. So that would be internal rotation, hold stretch 1 to 2 minutes, breathe into that stretch, then begin pressing the hands into the knees, knees into the hands, 0 to 100%. after 0 to 100% effort. Hold that 100% effort for 10 seconds. And then after that, regressive by going the other way, away from the hand, actively into internal rotation, deeper into the stretch for up to 10 seconds, and then back to your passive stretch in that newly acquired range. And then you can go back into that pals, pressing into the hands, rails, away from the hands, back to your passive. Okay, you should be able to gain about 10 to 15, maybe 20 degrees at most of range when you're doing that, just like you would with PNF stretching. Over periods of time doing that, you're going to enhance your range of motion, but not 1 or 2 or 3 sessions is going to help with that. So that's something that has to be done long term. Good job.